Hot flashes. Nearly 4 out of 5 women will have them, and 0 out of 5 appreciate them. So, what can be done about these unwanted symptoms of menopause? Today, we're joined by Dr. Vanita Rahman. She is putting together a program that can help women taper those flames once and for all. Dr. Vanita Rahman, welcome back to the exam room. Good to see you again.
Oh, thank you, Chuck. Great to be here.
As a guy, I don't really understand. Well, I will never truly understand what a hot flash feels like. But I will say, from everything that I have learned on the show, all of the women I have talked to who have suffered from them, they are absolutely horrific. And then to hear that 4 out of 5 women will suffer from them at some point during their life, that just doesn't sound like a whole heck of a lot of fun to me, Dr. Rahman.
No, I don't think any woman would describe them as fun.
So talk to me about this program here. Let me pull this up on the screen for those of you who are watching on Facebook or YouTube. If you're hearing this on the podcast, hop over to the Physicians Committee's YouTube page to check this out. Here it is, Hot Flash Free and Strong. It's a 12-week online nutrition program that you have helped put together. Hot flashes, I'm assuming they strike for much longer than 12 weeks. So how much benefit can come over the course of this roughly 3 months?
Yeah, so hot flashes, as you said, will impact 4 out of 5 women as they transition through menopause. And currently, we don't have really great treatments for them other than hormone replacement therapy, which has its own set of problems. So, this is a great way for women to tackle hot flashes with nutrition. Simple lifestyle changes that not only benefit hot flashes but can benefit them for life. And to answer your questions, 12 weeks, we feel that's long enough to make significant changes in one's diet and to start to notice significant improvement. In the research that was done, many women started to see improvements after 6 to 8 weeks.
That is huge. So 6 to 8 weeks, that seems like a really good investment here, and you're giving them 12 weeks to really make sure that they get
Mhm.
all of that information there. We said at the top that 4 out of 5 women, so up to 80%, will suffer from hot flashes at some point. If people were to really make some changes to their diet, focus on the lifestyle, focus on a lot of the things that you're going to be talking about throughout the course of those 12 weeks, how much in your estimation would that number tumble? It's 80% today. What could it be if everybody were to follow these suggestions?
But in the research that the Physicians Committee has done, women who followed a low fat vegan diet and supplemented with soybeans, the majority of them noticed significant improvement. And the majority of women that were having moderate to severe hot flashes no longer had them. So the impact can be quite profound.
Let's talk about what it is you will be talking about here in the program. So, you're talking about introducing the idea of eating an exclusively plant based diet. There's some intricacies that come along with that. So, as the 12 weeks unfold, what can women expect to learn?
Well, first they'll learn what hot flashes are, what causes them, what is the current treatment, and what are some nutrition based approaches that can work for them. And then not only are we going to teach them this very simple way of tackling it, but we're going to give them lots of practical tips. So, we recommend soybeans, but what do you do with soybeans? How do you cook them? How do you enjoy them? Where do you get them? Um, so, we're going to do a lot of cooking demos and then answer all those other questions that come up with nutrition interventions like how many carbs or how much protein or will I get all the nutrients I need. And then we know that women who are transitioning through menopause, their hot flashes are an issue, but there are other issues they may be facing. They may be wanting to lose weight, or they may be want to reduce their blood sugar or cholesterol or blood pressure, or decrease the risk of dementia or stroke or heart disease, and of course, women's health issues. So we're going to try to really address all of that in the program.
That's a lot to cram into 12 weeks. I'd be excited about that for sure. So let's talk about hot flashes really quickly. Number one, and I know that this is something that you will be addressing in the program, but what are they and typically how long do they last?
Yeah, so normally, let's say we are suddenly exposed to hot air, or we suddenly burst into a jog or a run or a sprint. Our body heats up, and then as it does, our body wants to cool itself down. And to do that, our blood vessels dilate. So instead of being narrow, they open up, and that helps cool us. We may start to perspire, and then all of that serves to reduce our core body temperature. Now, what's happening with hot flashes is that the body's overreacting to otherwise really small changes in temperature, and I'm sort of making this up to illustrate a point. Maybe normally a 5-degree temperature change would require that. Here, it could just be like half a degree. So our body sort of overreacts, and we do the same thing. The blood vessels dilate, and that feels like someone just cranked up the heat in the house. And women will find they break into a sweat, and then within a few minutes they start to cool down, and now they may actually feel the opposite. They may even start to shiver because they've cooled down too much. So this cycle lasts about 2 to 4 minutes for most women, and it can repeat once an hour or once a day. Everyone's a little bit different, and they often happen at night, disrupting sleep, which, as you can imagine, without a good night's sleep, it's much harder to get through the day.
I would imagine so. I think that every person on the face of the earth knows that they can be a little bit cranky pants if they're not getting that good shut eye here. Makes getting through the day a little bit more difficult. I was having a conversation, Dr. Rahman, with somebody close to me recently, and we were talking about, they were like, "Well, look, a flash is a flash. It is a short term thing." But this person also, though, was hot all the time. And, they're about at that age where you would think menopause might be creeping in, and so they may experience hot flashes, but this person is hot always. So
Mm.
when somebody's hot always like that, are they just warm blooded and this is not necessarily a hot flash, or maybe that's symptomatic of something else? Or could it be that, some people don't have hot flashes for 4 minutes, but instead they have them for 40?
Right. Well, the typical hot flash will last 2 to 4 minutes. And after that, it's like everything settles down in the body, but those 2 to 4 minutes are pretty uncomfortable. And then women go from being really hot to now maybe being sweaty and drenched in perspiration, having to change their clothes. Someone who's feeling hot all the time, that could be something different. That could be if they're maybe producing too much thyroid hormone or taking too much thyroid hormone. So if someone is always feeling like they're feeling warmer than others around them, but not in these discrete episodes, I would recommend getting that checked out with their healthcare provider to see if there's anything else that needs to be addressed.
And really quickly here, in terms of things that are contributing to hot flashes, I want to stick specifically here with diet. What is it specifically with animal proteins, eating a lot of meat, eating a lot of dairy, that may wind up being a contributor to hot flashes? Or is it more of a case of, well, we got to keep the fat low? Or a third option, is it a combination of the two of those?
Really great question. And I think what we've observed is that women who consume a low fat plant based diet and then supplement with soybeans, they experience significant improvements. Now, is it just the soybeans? Is it just the vegan diet? Is it just keeping it low fat? Or is it the combination of three? I suspect it's probably the combination of all three that's causing this. And what is it about animal based foods that makes it worse? Is it the high fat content? Is it the weight gain? Is it a combination? We don't know exactly. And that's sometimes one of the challenges with nutrition research. We can't pinpoint the exact thing, but we can start observing these trends that eating a certain way can lead to significant health improvement.
All right, and here's the deal. This program, it kicks off very soon. There it is, right there on the screen. Thursday, September 29th, running all the way almost to the holidays. There, December 22nd, Thursday evenings at 6:45 Eastern. So that's pretty convenient. Whether you're East Coast or you're West Coast, you can probably fit that into your schedule. If you're on the West Coast, just duck out a little bit early from work. You'll be fine. You'll be absolutely fine. 12-week program, and I believe I saw, this is very exciting for me. Dr. Christy Cobb is participating in this program. She is a pistol. I love me some Dr. Christy Cobb. Every time that she's been on the show, I have felt really, really enthused and left just kind of laughing to myself. So I'm really happy that she's going to be able to bring her own brand of plant-based health to this as well. So I think that it's a 12-week program that's just going to be really awesome and offer a whole lot of help. And Dr. Rahman, if people are interested in signing up, what we're going to do right now is include a link to that in the show description or in the episode notes. So if you're in the podcast, go to the episode notes. If you're viewing this on Facebook or YouTube, just look in the show description right now and you'll have the link right there to sign up. So I wish you and Karen Smith, wonderful dietitian, and of course Dr. Barnard and Dr. Christy Cobb, all the luck in the world. And to everybody that signs up, I hope that you all reap the benefits from this. And my hat is off to you for putting together another fantastic program. Dr. Rahman, thanks for being here.
Oh, thank you, Chuck. And I just want to make a little plug here for Dr. Christy Kopp. She's great. And she's going to be talking about another topic that women are sometimes uncomfortable to bring up, which is sexual changes that happen around this time. So we're just going to go for it and bring it all out there and discuss and really help women just enjoy all aspects of their health.
Oh, that's that Dr. Cobb. Like I said, her own brand. She brings it and she brings it really well. I love me some Christy Cobb, so I'm really excited. Please do go sign up for this program today. Get yourself some very sweet relief. It's out there to be had. And Dr. Rahman, you are definitely the conduit to that relief. So thank you very much for your time today.
Thank you, Chuck. Always good to speak with you.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.